Action.
You arrive to find a 37-year-old male who reports eating cookies he purchased at a bake sale. He has audible wheezing and is scratching red, blotchy areas on his abdomen, chest, and arms.
Okay, well, PPE, going to determine the scene is safe. Assessing number of patients, there's one. Nature of illness, wheezing, difficulty breathing, and itchy, blotchy spots on abdomen and arms. Going to request some ALS, and going to ask some questions to rule out presence of C-spine injury. Sir, have you fallen or hit your head recently?
No.
Okay, no need to stabilize C-spine. Okay, so my initial impression of this patient is poor. They have difficulty breathing. I want to assess their level of consciousness. So I'm just going to ask some questions to determine where they're at on the APPU scale. Sir, do you know your name?
Mike,
Sir, do you know where you are?
I'm at home.
Do you know what day it is?
It's Sunday.
Okay, do you know why we're here?
I'm called you because I'm having an allergic reaction to the cookies I ate.
Great. That's right. Yeah, and I'm Galen. I'm with the ambulance service, and I'm here to help. All right. So chief complaint is this allergic reaction from cookies ingested. Apparent life threats are going to be cardiovascular, respiratory compromise. So let's see. We're going to determine. We're going to check ABCs now. So starting with airway. So I'm going to check for the rate of respiration. I'm going to listen, feel for the rise and fall of the chest. What am I getting for respiratory rate?
So airway is patent, respiration rate is 26, respiration quality is
Okay.
wheezing and deep.
Wheezy and deep. And the rate was?
26.
26. Okay. And wheezy. Okay, well, it sounds like this person will benefit from some oxygen therapy, so we're going to administer high flow oxygen using a non-rebreather mask, 15 liters per minute, ensuring that the bag inflates before putting the mask on the patient. How's the pulse? Now that there's oxygen flowing, I'm going to check the radial pulse, and I'm getting
Rate of 120 and weak.
okay. Right on. Any bleeding?
No bleeding.
And what's the skin look like?
Skin is cold and clammy.
Okay. Alrighty. So we're gonna assess that this patient is a high priority, and we are going to transport immediately. Before we leave this patient's home, I want to make sure we're bringing any medication with us that might be necessary at the hospital. So I'm going to ask, do you have any medication, sir?
No. I have an EpiPen, but I'm scared to stick myself.
Great. Let's bring the EpiPen. From the back of the ambulance now, we're going to do history taking. So I'm going to be asking, starting with OPQRST and then sample. So O is for onset. Sir, when did this start exactly?
I ate cookies about 20 minutes ago, and I began itching all over about 5 minutes later.
Okay, and clarifying question, how many cookies did you eat?
2.
Okay. P, provokes, anything making it worse, or have you tried anything to make it better?
Well, I have the EpiPen, but I didn't want to stick myself. Nothing in particular seems to make it worse, but my wheezing keeps getting worse, and now I'm sweating really bad.
Yeah. Okay. Do you feel any pain?
I have chest pain and my throat feels tight.
I see. How would you describe that pain in your chest?
I'm having trouble breathing and I feel lightheaded and dizzy.
Okay. Is that pain in your chest, is it radiating anywhere else?
Just my throat feels tight as well.
Okay. And how bad would you say that pain feels on a scale of 1 to 10, 10 being the worst pain you've ever felt?
It's bad. I'm really scared.
Okay. And T timing, how has this progressed since you ate the cookies 20 minutes ago? You said the reaction started 5 minutes after you ate them, and how has that been?
Yeah, I started noticing it 5 minutes after I ate the cookies 20 minutes ago.
I see. Okay, so that's our OPQ-RST. We're going to continue our history taking into our sample. So any other symptoms that you're experiencing that we should know about besides what you've already explained?
No.
Okay, any allergies, sir?
Peanuts and penicillin.
Peanuts and penicillin, okay, noted. And you said you don't have any other medications. You do have the EpiPen though, right?
Right, no other medications.
Any pertinent medical history that we should know about?
I had to spend 2 days in the hospital the last time this happened.
Okay, this has happened before. I see, noted. Okay, last ins and outs. What was the last meal you ate?
The last thing I ate were those cookies.
Okay. And then events leading up to this, it sounds like you ate the cookies, right?
Yep, the only thing I've done is eat those cookies.
Okay. So our OPQRST and sample history are done, so we're moving into our secondary. So we are going to be looking more closely, doing a look, listen, feel of the affected systems. So starting with cardiovascular, we're going to be listening for that breath and continuing to monitor that. We're going to auscultate for breath sounds. So from a supine position, we'll check the front. We'll check the back, note any sounds that we hear. What do we hear when we do that? Yeah, okay. And then of course, in addition to that system, we're also looking at the skin. So we're going to check for tenderness in those rashes. We're going to see how they've been growing, see how the shapes change, and just note any colors or any blisters that are appearing there. From there, we're going on to our focused vitals. So we're looking at our vital signs, including the rate of respiration, the pulse, and the blood pressure. So we're taking the blood pressure, and what are we learning?
Blood pressure is 110 over 72.
110 over 72. Rate of respiration now?
14.
14, so it's gone down from 26, so that's quite a drop, so that's noted. And finally, our pulse?
120.
120, so about the same. Okay, so we're going to treat for shock as well now. We're going to put a blanket to help keep them warm. We're going to continue that high flow oxygen. At this point, we're going to call medical control, and we're going to let them know that we have a 37-year-old male well, we can't say the name over the radio actually, but with a history of anaphylaxis, allergy to peanuts. They are experiencing wheezing, pain in the chest, tightness in the throat. Vital signs are slowly dropping. We're administering high flow oxygen and just maintaining the airway and rechecking vitals every 5 minutes because this is a critical patient. While I have medical control on, I'm gonna ask them for any advice or recommendations for other interventions to help this patient, including asking for permission to administer this patient's own EpiPen.
Yes.
Permission is granted. So before administering this patient's EpiPen, I am going to verify the 6 rights of administering medication. So the right patient, this is his prescription. The right medication, this is epinephrine. The right dose, this is for adults. The right route, this is intramuscular. The right timing, meaning that this isn't an expired medication, and right documentation, meaning everything that we do, we're documenting. And Besides that, we're going to continue checking those vitals every 5 minutes because this is a critical patient. And when we arrive at the EMS unit, we are going to provide a detailed report.